Hi, I'm Jordan. This is my second video. I'm just going to do a video, just kind of tell where I'm at right now. We've been trying over a year. We made an appointment with a fertility doctor a few months ago, and now we are in the stages where we're getting all the testing done. So we had gotten most of it done, and the next step was to do an HSG test, and then from there, we would get a game plan together and see where we're at. So I'm just going to tell about the HSG test. I got the HSG test done the other day, and I was super nervous about it, but I had looked up a bunch of people's reactions to it, and it seemed like they kind of went from this was like a 1 on the pain scale, this was no big deal, to a 10, like this is barbaric, like you should be put to sleep during it. I don't know how they're allowed to do this test like while people are awake. So I kind of read different things, and then my doctor told me, it's like light period cramps. And I'm just kidding. And they offer to give you a Valium before, and I was like, oh, okay, step 1, say yes to the Valium. That's what I think, but I'm not trying to be a hero, and I thought I was going to be fine, and then I ended up being a nervous wreck the day of the test. So I took part of a Klonopin, and I was still a nervous wreck during the test. I should have taken the whole thing, but anyways, so I went to get the test done, and it was kind of an emotional thing because it was the first invasive test I'd done, so I guess it kind of really hit me like that we were to the point that we were seeing a fertility doctor, and we went for my husband's main test. The deposit was no big deal. That was like a date night for us. My mom watched the kid. We went to the fertility clinic. We made the deposit. It was fun. No big deal. Of course, my test has to be like painful and awful. But anyway, so for the HSG test, he's going to kill me. For the HSG test, I went in, and they called my name, and I went back. I was at like an imaging place, a local imaging place. And I went back, and there was like 3 other ladies in the waiting room, and they were in gowns. And I was just like, what? Why are we in gowns? I don't know. It just seemed, I don't know what I felt like the room felt like, but it kind of just felt creepy to me. So I went back, and there was like changing rooms, and the nurse was just like, sign off on this paperwork and get undressed and get in the gown. And I was like, oh, can I leave my dress on? Because I wore a dress because I thought I could leave that on. And she was like, negative, just take it off. So I was like, okay. Well, she was nicer than that. But anyway, so I was like, okay. So, of course, I'm like, oh, I'm going to have to get in this gown. So as I went to go put the gown on, I noticed on my paperwork, well, I guess I should tell you, I see a female doctor for an OBGYN, and I see a female doctor for at the fertility clinic. I've always seen a female doctor, and for personal reasons, I just have no desire to see a male doctor, and that kind of freaks me out. Like, my pediatrician was a male, but as far as for like female issues, I just don't want to see a man. Anyway, so when I saw the paperwork, it said a man's name, and I like opened back the curtain. I was like, hey, man, this is a man's name. I thought my doctor was going to be doing it. And she was like, oh, yeah, that's a man's name. Which I'm trying to think. I said, this is a man's name. I don't think I said I thought my doctor was doing it to her. I think I said, this is a man's name. She said, yeah, that's Dr. So-and-so. And then she just kind of left, and I was like, oh. So I was like, what? Why? Because I'd specifically asked if it was her going to be doing the test, because there is another doctor that's a male in the fertility clinic, and sometimes they do have to do the test because they're partners. But I had asked before this one, so I could mentally prepare myself. And so it just kind of threw me for a loop, and I was like, okay, and the nurse was gone. I was like, okay, I'm kind of freaking out now. And this girl was like, well, don't. He's super nice. His wife went through IVF. Like, he is so supportive and so sweet, and he kind of knows what we're going through because, he went through it with his wife, and now they have kids. And so I was like, please tell me he's old. And of course he wasn't. He was like young and not ugly. And I don't know. That shouldn't matter, but it did to me, if I'm being honest. And I'm supposed to be honest. So anyway, I was like super anxious about that, but I was already anxious about the test in general. So it was just like, I was like, why didn't I take that old Klonopin? Anyway, so I go back in the dressing room and I go to put the thing on, the gown on, and the whole back, like, it just ties around like your neck, but then your whole butt shows and you can't wear anything underneath. So I like come out with it holding it, and I'm like, are y'all's butts showing, or do I have a defective gown? And this really nice lady was like, hey girl, go back in there and get in the drawer and pull out another gown and tie it the other way and double them up. So she taught me a trick, so if you need to know that, there's your tip. So I had it going the other way, and then I was completely comfortable, and I kind of calmed down. I came out and sat in the waiting room with the other ladies in their gowns, and I was like, man, I wish, I was like, I'm just not used to seeing a male doctor. I've never done it before. And I think if I would have known, I could have prepared myself, but I'm just kind of thrown off. Anyway, so the lady that was going to get her test done while I was getting undressed, they do it in like 15-minute increments. And she came out and was like, good news, it's your doctor. I was so relieved. So then at that point, I was like, no matter what amount of pain that I'm about to go through, at least it's my doctor inflicting it on me. So I went in there and I was like, oh, I'm so happy to see your face. And I said, I've not seen a male doctor before, and I didn't want to start today before this procedure. And she said, well, you may have to have him sometime. And I was like, well, I'll cross that bridge then. For right now, I'm happy. So I went to do the test. Now, they say it's mild period cramps. I wouldn't describe it like that. I thought it was painful. I thought it was only like a 7 on the pain scale. But I didn't have any blocked tubes, so I could very easily see if you had blocked tubes, it going to a 10. Because a lot of the people say it's like a 9 or 10 and all this stuff, and it like made them want to jump off the table. I didn't feel that, and I think I had built it up so high in my head that it was going to be like a 10. When it was like a 7, I just turned to him, I'm like, this hurts. I was like, I wouldn't exactly describe these as period cramps. I think that's a little misleading. Just trying to, poke some humor at it. But it actually went really fast. I was thankful for that. But the only thing about the test was I was so focused on whether the test was going to hurt or not that it never crossed my mind that they could find anything. So I was just like, oh yeah, I'm done. And she was like, well, I want to show you something. And she was like, you see how it's rigid right here in your uterus? And I actually did see it. You could see it pretty plain. She said, well, that usually is an indicator of a polyp. So we're going to need to go in and remove that and kind of check everything out. So we'll need to do surgery. And so I was just like, okay. And honestly, I had, a part of a Klonopin at that point. So, I couldn't really come up with, she was like, do you have any questions? And since I knew nothing about what a polyp was, I just kind of heard the word before. I had no questions, and I was just thankful to be done. So I was just like, no, thanks. And she was like, well, we'll call you later and schedule your surgery. So I haven't gotten that scheduled yet. They ended up, they said my treatment plan's still up in the air as far as whether that surgery is going to take place at the hospital or at the clinic. And so they're still kind of ironing that out. But I just wanted to let you ladies know it does not last very long. I wouldn't describe it as period cramps, but everyone reacts differently. But it's not something that you should just be so anxious for. But I would say, personally, I had some good advice from a fellow fertility clinic goer that's gone through everything, and she kind of tells me stuff. She said that she would take the Valium. Next time I will tell them yes to the Valium, and I won't wait last minute and take, part of something, but I would definitely go ahead and do that, just because the way I look at it is if you have someone driving you, and I had my mom, there's just no reason to be bent out of shape about it, when you can be pretty at peace about it. So it's not that terrible of a procedure, and it gets us one step closer to hopefully having babies, or baby. But anyway, so I just wanted to do a video telling my experience with it. I think these videos are so helpful and so awesome of other people's. They help me so much. Like, I literally will follow people's journeys and when they say that, like, they just got on Clomid, I'm, like, looking up their video, you know, so they can tell me about what it's like to be on Clomid. So when I first found out I had a polyp, I've been down, like, the last couple weeks. I guess it's just been, like, a week or two, actually. But I've kind of been down, not because, like, they can be cancerous, but it's not because I'm worried about cancer. It's just kind of, I thought we were finally to the point where we were going to have the sit-down meeting with all our test results and put me on Clomid or the trigger shot or whatever she plans to do and start trying to conceive. But now I know that I have to wait. So, you know, we're using protection now and we're not trying to conceive because we have to have that polyp removed. But I started thinking about it, and even though it is a bump in the road, literally, and a delay, it's also good because polyps can cause miscarriage and they can cause you to not be able to conceive a baby. And so it's just really, I'm thankful just because they can also, if they're not cancerous, they can turn cancerous later. We may not have even have seen it if I wasn't having this HSG test done. If I wasn't having infertility issues, I wouldn't have seen it. And a lot of times there's not symptoms with it if you do have cancer. So I'm happy that that's going to be removed. That's a blessing. I'm happy that, you know, my doctor knows way, way more than me. And even though when we first went to the fertility clinic, I was like, why are we running all these tests? This is expensive. And I was like, do we need to do this or can we just wait? And she was basically like, well, you know, we do all these tests, you know, because we don't want to have you spend your money on one thing just to find out there's something else that's also causing your infertility and, you know, and you have wasted your money. So we just kind of do the testing first. I'm so thankful she said that because, you know, with it causing miscarriages, I think having a miscarriage would be devastating even if you didn't think you wanted kids, but then you found out you were pregnant and then you got excited. I think that would be devastating, but I also think it would be devastating, you know, if we've been trying, you know, for, you know, 16 months to get pregnant, we finally see the positive test and we're thinking about what this child's going to do and everything. And then we lose it. I just think that would be devastating for me and my husband. So I'm thankful that they found I'm thankful that they found the polyp and that they're going to remove it. So hopefully very soon we'll be having our meeting with our doctor with all our test results to decide, you know, how we're going to proceed from here. I do have PCOS, so that diagnosis has been helpful because even if you're not trying to conceive a baby, if you have PCOS, you need to know it. And, you know, I've always struggled with my weight, and I found out some of the things that I was eating, even though they were healthy, they were still sabotaging me as far as being insulin resistant due to PCOS. So that's going to really help me. And I'm just excited I'm excited. I go from, like, excited to down to excited to down. Just because, you know, every time we spend money on something, I'm like, oh, we're spending this money that we don't have on this. But then I'm also like, you know, maybe this will work. So I'm really optimistic that I'm not ovulating and that Clomid could be a easy fix. I'm hoping that our journey will stop there. But if not, I know you awesome ladies on YouTube watching her videos is going to help me deal with all the other tests and everything. And I was joking with my sister-in-law tonight, and she was saying, you're going to have to tell this kid how hard it was, you know, to conceive him or her. And I said, well, I think what I'm going to do is anytime they act up, you know, put them in timeout, turn on YouTube, and let them watch a 45 minutes worth of how mommy tried and daddy tried to conceive you and how much of a pain it was. So, anyways, thank you so much for watching. And if you have any questions, comments, anything, let me know. But I'll probably do these updates anytime I have any type of procedure or anything like that, just to kind of let other people know what to expect and just so I can look back on my journey and just kind of remember it. So have a great week.